Okay, we are waiting for some other participants to join. We are going to discuss today about diphtheria. We have previously discussed about measles, mumps, rubella. Okay, so participants are joining. Previously discussed about measles, mumps, rubella. We are going through respiratory infections, and in which our next topic is on diphtheria. Okay, ask your other colleague to join also. Is my voice clear and audible? Write down in chat box. Is my voice clear and audible to all of you? Write down in chat box. Okay, so first of all, epidemiology of diphtheria. Write down in chat box. Is my voice clear and audible? Okay, so it is audible. Okay, fine. So epidemiology of diphtheria. It is an acute infectious. See, acute. You understand the meaning of the word acute very well. So acute is the condition which is short-lived, and chronic are conditions which are for longer duration. So it is an acute infectious disease. It is also communicable disease. So we are discussing that, about communicable disease. So it is under the category of that. You know about non-communicable disease also, characterized by involvement of respiratory system. So it is again involving respiratory system. There is local production of the membrane. This is the characteristic feature of diphtheria. Membrane formation in mouth is characteristic feature of diphtheria, and general symptoms caused by absorption of toxin. So here in diphtheria, there is role of toxin secreted from the bacteria, Corynebacterium diphtheriae. Right? So C. diphtheria secretes this toxin, and because of this, all the pathogenesis and signs and symptoms are developed. So remember that it is respiratory disease. See, this definition or introduction says many things about diphtheria. First of all, it is acute disease, infectious disease, communicable disease, right? Involving respiratory system, and mainly this characteristic feature is membrane. Remember that this diphtheria can be easily diagnosed by mouth examination. I'm going to show you later on photograph of that also, by membrane formation, and general symptoms are caused because of the toxin. So in history, it was first recognized by clinical entity by the scientist Bretno in 1926 and called it diphtheria. Right? And there are various scientists. If you do not remember the names of all the scientists, then it will be okay. Just for your knowledge purpose, the diphtheria bacillus was first observed and described by Klebs in 1883. So many years before, 1883, right? More than 140 years before, 137 years before. First cultivated by Loeffler in 1884. Okay. Hence, it is also known as Klebs-Loeffler bacillus. On the name of these two scientists, Klebs and Loeffler, this bacilli is also called as Klebs-Loeffler bacillus. Rooks and Yersin discovered the diphtheria exotoxin and established its pathogenic effect. So, toxin was established by these Rooks and Yersin. Von Behring described antitoxin against this toxin produced by diphtheria. And sick, you know about the sick test. You may have heard about the sick test, which is the diagnostic test for this susceptibility. It produced for the susceptibility of the beers in his name. Right? So if you remember this Klebs-Loeffler, then it will be also okay. Klebs-Loeffler bacillus. Why it is called? Because first observed, described, as well as cultivated by these two scientists. In problem statement, in developing country, it is endemic, while in case of the developed country, it is rare. So is the general term that infectious disease generally, forget about corona, infectious disease generally they are very less in number in developed countries like UK, USA, or European countries, or countries of this Americas region, right? So while in case of the developing country, this communicable or infectious disease, they are more prevalent as compared to developed countries. True number of the cases and deaths are unknown because of the incomplete reporting from most of the countries. It happens in many cases, not in case of the diphtheria. So you may have heard about the reporting system of corona also. Many countries are still having the disease, but they may not be reporting, you know very well the names of the country. So it may be possible that many region of the country may be also under reporting. So it happens in case of the many diseases that due to under reporting, actual number of the cases may be hidden. You may have heard about this corona through various newspapers. That newspapers are writing that this particular region or particular city may be less reporting the deaths or number of the corona. So it may happen in any other disease also. So there was an outbreak in Afghanistan in 2003 in Kandahar. You know that Kandahar. You may have heard about this famous Mahabharata character, Gandhari. She belongs to this Kandahar, and eventually this name is Kandahar. Kandahar is old Mahabharata Gandhar region, Sakuni Mama's region. There was number of 50 cases there at that time reported, and even though it was outbreak, there only 3 deaths were there. So case fatality rate is 6%. How case fatality rate is 6%? Out of 53 deaths, so out of 100 there can be 6 deaths. Age group, 74% of the cases were of 5 to 14 years of age group. So this was about the last outbreak which was observed in this Kandahar region. In India, it is endemic disease. Endemic means, can you write down in chat box what is endemic? What do you mean by endemic disease? Write down in chat box. What do you mean by endemic disease? What do you understand by endemic disease? Till you write your reply, I am further taking this. Declining trend was observed after immunization. In 1987, there were around 12,000, or we can say 13,000 cases, while in 2000, only 265 cases were there, because at that time vaccine was introduced, and so decline is by 99% almost, right? So declining trend is because of immunization. So this is one more data, and don't need to remember the data, just understand the concept behind the data. This is one more data to favor the immunization, that because of the immunization, diphtheria cases decreased from 1987 from 13,000 to only 265, 2,000. And today we are also waiting for the vaccine of corona, that we hope that if the corona vaccine will be developed and it will decrease the burden of the disease. Right? So yes, one student has replied that particular group. No, endemic means the disease which is constantly present. Like in case of India, malaria, this measles, malaria, diphtheria. Diphtheria is also endemic disease. Tuberculosis, it is constantly present in all over the country. So it is considered that endemic disease. Epidemic is what? Sudden rise of the disease pattern. It is epidemic, like corona, sudden rise. Actually, it is the emerging disease. So if the sudden rise is there, or outbreak, we can say it is epidemic. In simple words, I am explaining you. It is not exact definition. Endemic is constant presence of the disease. And pandemic is what? Currently, we are experiencing pandemic. Pandemic is global epidemic, globally, all over the world, or in one or more country, in more than one country, one political region. Epidemic is there, or we can simply say global epidemic is pandemic. Right? Then agent factor, the name of the bacillus which is causing diphtheria is Corynebacterium diphtheria. Remember this. Corny means club and diphtheros mean leather. So they are observed in club formation, club-like formation. So it is Corynebacterium diphtheria. It is gram-positive bacillus, non-sporing. There is no spore. Non-capsulated. It doesn't have the capsule. And non-motile. They are not motile. Their motility is not there. Movement is not there. Slender means very thin. Rod-shaped bacteria. You can observe the microscopic picture of the Corynebacterium diphtheria. Gram-positive Corynebacterium diphtheria. Right? You may have learned this in microbiology also. Right? So gram-positive, non-sporing. They do not have spore. They do not have capsules. So non-capsulated, non-motile, thin means slender, and rod-shaped bacteria. Rod-shaped means this is rod shape. Suppose cocci are there, then this is dot shape. These are cocci. These are cocci. These all are cocci. These all are rod shape means these are bacilli. Right? So here also bacilli. So arrangement of this is again Chinese letter pattern. So it is in Chinese letter. So what how the Chinese letter look like? If you know the Chinese, then you can easily identify this Chinese letter cuneiform. Right? They are usually seen in pairs or palisades or in small groups. So it is club, right? So corny means club. In they are seen in small group. The bacilli being at various angle at to each other, resembling the letter of the V or L. You can see over here, this is like L, or you can see V also, but it is like L. See L. This is L, right? So here also you can see this may be not exactly V, but here it is looking like Y. Okay, but this is of microbiology concern. So this is better. It can be if you write down these things in microbiology part. In PSM, you do not need to remember all this detail. Just you remember gram positive as well as the name of the bacteria, Chinese letter pattern, classification. The McLeod classification is there for Corynebacterium diphtheria. They are according to this classification distributed into graves, then intermediates, then mites. Okay. So not all the strains of the bacteria are virulent, organism are virulent. Non-virulent forms are also there. No need to remember these names. Okay, so we were skipping this part. Again, you can see this electron microscopic picture of the Corynebacterium diphtheria. Toxin, extremely potent, exotoxin, and protein in nature. So this toxin has what role in developing the signs and symptoms. Generally, in many bacteria, like in case of the diphtheria, bacteria itself do not produce the sign and symptom. It does not cause toxicity, but the toxin produced from the diphtheria, Corynebacterium diphtheria, it will produce the sign and symptom. So even if the bacteria die, this toxin, if it is present, it can cause the signs and symptoms of the diphtheria disease. So again, this is the figure of the toxin. No need to remember. So source of infection. Now we have gone through the agent factor. In agent factor, source of infection, it may be either case or carrier. Carrier, again, it can be temporary carrier, short-lived, or permanent carrier. It may be causing disease for longer period of the time. Again, carrier may be nasal, means from the nasal secretion, it may be the source of infection, or throat secretion, it may be the source of infection. So cases and carriers both are source of infection. Like in case of the corona also, we can say that cases are always there, but even asymptomatic carrier may be the source of infection in corona. Those person who is suffering from corona but may not have the symptoms, sign and symptom, may transmit infection to other person. So it is considered as the carrier who do not have the sign and symptom and transmit the infection. Carrier, or we can say just like subclinical case. Case, it ranges from the subclinical to frank clinical case. Subclinical means symptoms are very mild or no symptoms, or frank clinical means obvious symptoms are observed. Temporary carrier, it may last for about 1 month. Permanent carrier persists for 1 year. Permanent carrier may be transmitting the infection for about 1 year. Temporary carrier for 1 month. Unless the patient is treated. So if the patient is treated, then this temporary, he will not be longer as a permanent carrier. Carrier are more numerous and are the common source of infection than cases. Right? So carriers, because they are not recognized, carriers do not have the sign and symptom, that they are not recognized. So they are the more common source of the infection. Like if the ratio is 95:5, 95 carrier is to 5 cases. Right? So if there are 100 patients who are transmitting the infection, among them 95 will be carriers and only 5 will be the cases. We can say like that. Nasal carriers are more dangerous than the throat carriers as the source of infection, because there can be frequent shedding of the organism into environment from the nose. So if you have the nasal infection and throat infection, so more frequently from the nose, there can be frequent discharge of the material due to sneezing or during expiration also. As compared to the throat, the bacteria are there in the throat region. If you develop cough, then only you can transmit the infection, in larger quantity. Then you can only discharge the bacteria or virus in larger quantity. Of course, during speaking also there is some low transmission of the bacteria or virus. But here in case of the diphtheria, nasal carriers are more dangerous. Immunization does not prevent the carrier state. Again, in agent factor, infective material is nasopharyngeal secretion. Whatever the secretion is from the nasopharynx, it can be infective material. Plus discharge from the skin lesions. In diphtheria, there are skin lesions. So whatever the discharge is there, secretion is there from the skin lesion. Contaminated fomite and possibly the infected dust. So here, fomite. So fomite is what? That if I have sneezed or I have coughed right now over here, so this my material of the sneeze or cough may be falling over my table or over my laptop or my mobile. If I touch them, it will come into my hand, and if I touch my hand over my face, then this infection may be transmitted to me through mouth as well as through nose. Infected dust during the sneezing and coughing, infected dust, it can also, if it is inhaled, it can also lead to the transmission of the disease. Period of infectivity. For cases, it can transmit infection for 14 to 28 days. If I have the diphtheria, I can transmit infection as long as 28 days to other person. And in carriers, it may be longer period. You have seen that too. There are two types of the carrier. Temporary carrier as well as permanent carrier. So temporary carrier can transmit infection for about up to 1 month, and permanent carrier can transmit infection up to 1 year. Host factor. So that was about the agent factor. Now host. In first of all, age. It particularly affects 1 to 5 years of the age. So diphtheria, it is common in childhood, under 5 child, particularly 1 to 5 years of the child. In countries where widespread immunization is practiced, a shift in age incidence has been observed from preschool to school age group. Same as measles. We have seen that due to immunization, the measles is nowadays seen in higher age group, in adults also. Likewise, in case of the diphtheria, because of the immunization in childhood, there is shifting of the age to higher age group. It is during the school age group also. Both sexes are equally affected. It is not so that male is more affected than female or female is more affected than the male. Both sexes are equally affected. Immunity. One attack of the disease generally leads to long-lasting immunity or lifelong immunity. Same as measles, same as chickenpox. Once you have this diphtheria, you will not have diphtheria in lifetime because one attack protects the person lifetime. There are, however, instances of multiple attack, but it is very rare. So infants are protected from the birth up to the age of 3 months, up to the age of 4 months, or up to the 6 months. But percentage may vary. Up to 3 months, 60% protection. Up to 4 months, 50% protection. Up to 6 months, 17% protection. Where does this protection come from into the newborn? It is coming from antibody transmitted by mother during delivery, right? But by 1 year of the age, nearly all are susceptible to the disease, and so that there is role of vaccine, right? But actually, vaccine is started right from the age of 1.5 months, because you know that up to 3 months, 60% protection. We want to give more than 90% protection in the community, so that remaining 10% may be also protected because of the herd immunity. So vaccine is introduced at the age of 1.5 months in the form of pentavalent. So pentavalent is it is containing this vaccine. We will see in prevention part further about that. Environmental factor, all seasons, although the cold month favor its spread, but it is present in all seasons. Generally, these respiratory infection, viral infections, they are more common during the cold season. Mode of transmission, mainly by droplet infection, right? Infected cutaneous lesion, or by object like coughs, thermometer, contaminated by the nasopharyngeal secretion of the patient, right? So this is how you can see that during coughing, this type of the respiratory infection like diphtheria, it is transmitted to another person. You can see that coughing will transmit the infection to another person, right? So coughing well, these are all bacteria. So you know that there is role of mask. That person who is having the disease, he should particularly wear the mask. Although both of them should wear the mask, right? In case of the COVID, we have the guideline that both of these should wear the mask so that this infection may not be transmitted to other person. Okay, so this is the good picture to show you the transmission of infection through respiratory secretion. Now, predisposing causes: oppression in the area of the nose or throat, it may lead to transmission. Economic status, it is more common in lower socioeconomic class. This type of the infectious diseases are more common in lower socioeconomic class. Lack of proper nutrition, again, all the infection, it applies to all the infection. The malnutrition will lead to predisposition of the infection. And overcrowding, yes, you know that respiratory disease, they are more commonly spread in overcrowded environment. Like you observe in case of the corona also, that corona is more common in mega cities like Mumbai, Delhi, Ahmedabad, like in Surat. As compared to the villages, as compared to that, there are very low number of the cases, very less number of the cases in villages. So the persons population who is living in overcrowded environment, any infectious disease, particularly respiratory disease, are more common because of the overcrowding. It can be transmitted easily from one person to another person. Okay, so let me answer some questions. Give the answer of the question. What is the causative organism of diphtheria? Causative organism of diphtheria. Write down in chat box. What is causative organism of diphtheria? Write down in chat box. Second question. First question. Till you type the first question, answer of the first question. Second question. First of all, send me the answer of first question. Causative organism of diphtheria. Second question is types of carrier. How many types of carrier do you know in case of the diphtheria? Write down the answer. Yes, Corynebacterium diphtheria. Some of the students have written. Corynebacterium diphtheria is the causative organism. Types of carrier. Types of carrier. Write down the types of carrier in chat box. In diphtheria, we have discussed some types of the carrier. Types of carrier. Write down the types of carrier. Yes, nasal, throat carrier. Very good. Then temporary carrier and permanent carrier. Very good. So what is difference between temporary and permanent carrier? Difference between temporary and permanent carrier. Difference between temporary, yes, temporary, permanent, nasal, throat. What is difference between temporary and permanent carrier? Difference between temporary and permanent carrier. Or temporary carrier can transmit infection for how much duration and permanent for how much duration? We have already discussed. Temporary carrier can transmit infection for how much duration? Yes, temporary for 1 month and permanent for 1 year. Very good. Okay. Which age group is most affected by diphtheria? Which age group is most affected by diphtheria? Some other students are also writing temporary up to 1 month and permanent up to 1 year. Okay, fine. Which age group is most affected by diphtheria? Which age group? Yes, 1 to 5 year age group. Okay, very good. Preschool to school age group. It is because of the immunization now. Yes, most commonly 1 to 5 year age group, but up to 15 years school age group also may be affected because of the immunization. Right? Okay, now we are moving further. So portal of entry of this is respiratory route. So whatever the material is sneezed or coughed, it may be entered. It is entered to the other person by respiratory route. Although non-respiratory route like skin cuts, wounds, and ulcer, it can also transmit the infection, but majority through only respiratory route, most common. Umbilicus of the newborn, eye, genitalia, middle ear, these are also other routes through which infection can be transmitted. Incubation period is 2 to 6 days. What is incubation period? Write down in chat box. Till we are discussing further, but write down in chat box what is incubation period. We have discussed previously also. What do you mean by incubation period? It is 2 to 6 days in case of the diphtheria. Now, that was about epidemiology, agent factor, host factor, and environmental factor we have seen, particularly concentrated on agent and host factor. So, I'm waiting for the answer of the incubation period until we are discussing further about the clinical features. Clinical feature, complication, and diagnosis of diphtheria. So, onset of the disease, it is rarely sudden. The symptoms are infrequently severe. Right? So, onset of the disease is slow. It means onset of the disease is slow. It is not suddenly that you will develop diphtheria tomorrow morning. It will be slowly developing. Right? Symptoms are infrequently severe. Means it may be mild first of all. Moderate temperature, 102 degrees Fahrenheit, malaise, sore throat, and tired feeling. These are initial symptoms. Let me check the answer. Yes, time between entry of organism and development of the symptom. Very good. Entry of organism, development of symptom. Almost whoever has replied, written same. So it is the time duration between entry of organism and development of first sign or symptom. Just add this word first sign and symptom. Okay. So moderate temperature, malaise, sore throat, tired feeling. Sore throat is not marked initially. This delays the discovery of the illness. If there is sore throat early, then you can early diagnose the patient. But only temperature and this malaise, tired feeling, on that, based on that, we cannot diagnose. If there is sore throat, we can examine the throat and we can see the membrane. Then we can diagnose that there is diphtheria. But it is not marked initially. Membrane formation is due to necrosis of the epithelial cells, serofibrinous material liberated which from greenish white membrane. So, because of the necrosis of the epithelial cells in mouth region and this material which form the greenish white membrane in the mouth, and this is the characteristic feature of diphtheria. Edges of this membrane are curled, curly edges, and separated from the underlying mucous membrane. If you touch this membrane, it bleeds on peeling. Or if you peel this membrane, try to peel the membrane, it will bleed, and there is increased toxin absorption. So this is the characteristic feature of the diphtheria membrane. Right? It bleeds on peeling and result in increased. We have already seen. Usually, one tonsil is involved and soon spreads to opposite side. So first of all, one tonsil is involved and soon it will involve other tonsil also. Patient discovered late shows extension from the tonsil to fuses to pharynx. So extension of the disease will be, so this membrane will cover first of all one tonsil, then another tonsil will be involved. If you in later stage, it will involve up to the pharynx also. In mixed infection by secondary bacterial infection, it is called septic diphtheria. And septic diphtheria is characterized by if there is diphtheria plus secondary other bacterial invasion. And apart from the diphtheria, if there are other bacterial invasion, it is called as mixed infection, like streptococci and diphtheria, mixed infection. There can be high-grade fever, atypical appearing membrane, and greater inflammation in surrounding structure. And further in clinical feature, there can be local inflammation, membrane formation, we have already seen, and toxemia. Right? Forms of diphtheria, these are classical forms of diphtheria: tonsillar form, pharyngeal form. As the name suggests, tonsillar forms means tonsil is involved. Pharyngeal form means pharynx is involved. Laryngeal form is larynx is involved. Intranasal and other forms. These are the forms of diphtheria. You need to remember this. So first of all, tonsillar diphtheria. It is the most common form of the diphtheria. Initially, there is thin membranous spot, few millimeter on one tonsil, more often identified on two tonsil as grayish yellow membrane. It is same as we have previously discussed, just under the heading of tonsillar diphtheria. You already know about this membrane, that initially there will be formation of the membrane over one tonsil. It will be few millimeter in its size, and later on it will involve second tonsil also, and it will be grayish yellow or grayish white membrane, you can also say. Narrow area of redness around the membrane. There can be redness. This redness suggests what? Inflammation, right? Tender and enlarged submandibular lymph node. So lymph node involvement will be also there. So because of the infection, toxin drain into the lymph node, submandibular, that is below mandible, the lymph node will be enlarged and it will be tender. And fuses are normal. Again, you can see the membrane over the fuses, right? Membrane. You can see this membrane over the tonsil. Here you can see this membrane over the tonsil. This is tongue depressor, and this is wooden tongue depressor. This is nothing a part of mouth. So do not be confused with this. Membrane is over here. I have again marked with the arrow. This is membrane over the tonsil. Then pharyngeal diphtheria. So again, the name suggests pharyngeal means there will be involvement of the pharynx. So membrane spreads to the side of the uvula. Uvula, you know that it is the long structure in the mouth. When you say ah, then you can observe the uvula. So if you go to the doctor for examination and doctor throws the light over your mouth and asks you to say ah. So upon speaking ah, uvula will be observed. Try this thing in front of the mirror. Say ah, and you will observe the uvula. Spread of membrane. This membrane will spread from anteriorly up to the teeth, from post-pilar to nasopharynx, and then to nostrils. And early form membrane gets necrotic as newer parts advance, and this necrotic material produce foul smell. Because of the necrosis of the membrane, there can be foul smell, right? And which is known as fortis oris. Fortis means forter oris means foul. When bleeding occurs from the membrane, foul black mass of the tissue will be there. Throat tissue is congested. There can be another characteristic feature. There is bull neck. Because of the swelling of the tissue in front of the neck, the movement of the neck becomes restricted and it is considered bull neck. Lymph node are not palpable. So these are all characteristic feature of the pharyngeal diphtheria. Right? So spreading of the membrane over the uvula up to the anterior part of the teeth, post-pilar region, outer oris, that foul smell, bleeding upon the this whenever the membrane becomes the black foul smelling black mass, bull neck. These are the features of pharyngeal diphtheria. You can see bull neck, right? Then laryngeal diphtheria, most commonly due to mitis type of the Corynebacterium diphtheria. It is secondary spread from the fuses and may spread to the trachea, bronchi, and bronchiole. So laryngeal may spread to the trachea, bronchi, and bronchiole. Symptoms due to obstruction. If the laryngeal diphtheria is there, larynx will be obstructed. So there can be difficulty in breathing. If the trachea is obstructed, difficulty in breathing. There can be also, here it is written, inspiratory distress. Because of the difficulty in breathing, there can be inspiratory distress. If the trachea or larynx is blocked because of the diphtheria. Huskiness of the voice, croupy cough, stridor. Stridor is most common in children. Stridor is typical type of the sound during this respiratory movement. Danger of the laryngeal diphtheria is asphyxia. If this membrane covers the majority part of the larynx, and because of this there can be inspiratory distress and it may lead to asphyxia. Right? So in this case, tracheostomy operation is required. So what is done in the tracheostomy? A hole is made over the neck region, bypassing the nose for breathing. So here over the neck region, a hole is made. That is called as tracheostomy operation. So through this hole, patient can inhale and exhale, bypassing the laryngeal part. Enteral nasal type of the diphtheria. Here discharge, which is initially thin, blood stain, which becomes thick and mucopurulent. Discharge contains this Corynebacterium diphtheria in large number. There is thin yellowish membrane. So in intranasal, whatever the discharge from the nose is there, this thin, blood stained maybe, or thick and mucopurulent later on. And it contains Corynebacterium diphtheria organism in large number. There is thin yellowish membrane present in intranasal type of the diphtheria also. Others type, they are non-respiratory form. They are skin-related, skin, eye, intestine, genitourinary system, diphtheric carditis. If you remember the tuberculosis, in tuberculosis also multiple organs maybe. It is tuberculosis can involve other organs also apart from the lungs. There can be development of tuberculosis in all the part of the body except hairs and nails. Here also it is not exactly same, but other organs may be also affected, but they are most commonly, which is the most common type of diphtheria, just we have discussed. Which is most common type of diphtheria? Just write down in chat box till we are discussing further. Skin, it is common in tropic region. We will quickly go through these other parts because they are not much important. Seen mostly on fingers as well as back of the hand. Punched out ulcer may be seen. Eyes is secondary to anterior nasal. It spreads to the nasolaryngeal duct, and it can infect the conjunctival also. So conjunctival diphtheria is there. Slugging of the conjunctiva and corneal damage can also occur. And there can be panophthalmitis. It is skin sore due to diphtheria, skin ulcer due to diphtheria. Intestinal form secondary to the facial diphtheria. Because of the intestinal involvement, there can be dysphagia, bloody diarrhea. Right? It can be diagnosed with at the time of autopsy. Urogenital system, it is to the urogenital system. Diphtheria is transmitted through the fingers by contact. In male, coronal sulcus of the glands of the penis may be involved. In female, vulva and vagina may be involved. Diphtheric endocarditis means heart. It is highly fatal but rare, right? And caused by Corynebacterium xerosis. So I have asked one question: which is the most common type of the diphtheria? Nobody has answered. Write down the types of diphtheria. Just write down the types of diphtheria. Types of diphtheria. Types of diphtheria. If you know most common type, then also write down. I'm waiting for your reply. What are the types of diphtheria? And write down the most common type of diphtheria. Yes, tonsillar. Tonsillar is most common type. Other types are pharyngeal, laryngeal, intranasal. Very good. Okay. Now mention what are the signs and symptoms of diphtheria. Respiratory and cutaneous. Yes, broadly you can say like that also. Respiratory and cutaneous. Respiratory is involving, again, it is divided into tonsillar, pharyngeal, laryngeal, intranasal, and cutaneous is on skin. Now, what are the clinical features of diphtheria? Clinical features. Clinical features of diphtheria. Waiting for your reply. What are the clinical features of diphtheria? Till we are going through this complication of diphtheria. Cause of complication is toxin. So all the clinical features are also because of the toxin. So complications are also because of toxin. Severe complications are seen in case of the nasopharyngeal type of diphtheria and laryngeal type of the diphtheria. Some of the complications you have seen that asphyxia. Because of the laryngeal type of diphtheria, there can be inspiratory distress and asphyxia, and patient may die also. That is considered as the complication of the diphtheria. Earliest severe complication in nasopharyngeal diphtheria is myocarditis, involvement of the heart, myocarditis. Right? Complications are rare in case of the nasal, tonsillar, and pharyngeal diphtheria. So just remember these two most common type where complication occurs, right? Nasopharyngeal and pharyngeal. They are rarely causing otitis media, albuminuria, or this pure tonsillar abscess, peritonsillar. It is peritonsillar actually, peritonsillar abscess. So whatever rare, you need not to remember the rare thing. Just remember most common thing where complications are present. So cardiovascular complication, myocarditis, or paralytic complication like palatine involvement. There can be involvement to the eyes, pharynx, larynx, respiratory muscle, limbs, heart, encephalitis. These are paralytic complications which affect these organs. So who have written the answer of previous question? Yes, necrosis of the epithelial cell, it is not clinical feature. Production of the membrane, swollen gland, difficulty in breathing, malaise, sore throat. Okay, so many have written about the membrane, high-grade fever, inflammation. It is moderate fever, not high-grade fever. High-grade fever is mixed infection. Inflammation typically appear option to membrane, tonsillar. That was the answer of previous question. Okay. So in complication, early myocarditis, time of occurrence between 3 to 7 days. Here it includes the changes like pallor, rapid steady pulse, collapse of the blood pressure means blood pressure decreases, vomiting, upper abdominal pain, heart sounds and heart rhythm are normal. Shock may be also there. Patient dies within 10 days without cardiac involvement. So myocarditis is involving only muscles, right? So and the internal cardiac involvement, just apart from the muscle, if there is no involvement, then patient can also die because of the shock, right? Because of the shock. If patient survives, there are signs of the cardiac involvement. Late myocarditis between 5 to 14 days. Here also severe pallor, weak, slow, steady pulse. S1 will be absent and S2 is soft. S1 and S2, you know that these are the hard sounds. S1 absent, S2 soft. Heart rate is irregular, gallop rhythm may be present, severe abdominal pain, peripheral and splenic vascular dilatation. Apex is shifted towards outward and downward. So these features are considered as the involvement of the cardiac part. Myocarditis, in myocarditis we have said that cardiac part is not involvement. If these are the features, then it may suggest that there is cardiac involvement, particularly heart sounds, heart rate, right? Apex part is shifting of the apex. And this is of importance in your medicine part also. In medicine, you have to write down detailing. You have to understand the symptoms in detail. Right? ECG changes, again, this is part of medicine. T wave is inverted or flattened. Lengthening of the PR and QT interval. Usually, patient recovers without any evidence of the cardiac damage. Paralytic complication. Palatal paralysis is most common. Right? So it sets between 3rd week and lasts for 2 weeks. There can be pronunciation is difficult in pronunciation because patient is unable to direct the lips. So because of the palatal paralysis, there can be difficulty in speech, right? Difficulty in speaking. Pronunciation becomes difficult. If the eyes are paralyzed, there can be blurred vision, paralysis of accommodation, and it persists for a week. There can be convergent squint. Pharyngeal paralysis may lead to difficulty in swallowing, and saliva is collected at the back of the mouth, and the patient is not able to properly discharge the saliva, secrete the saliva out of the mouth or into the mouth, then this will be collected over the back of the mouth. If the larynx is also involved, aspiration, there can be aspiration into bronchial tree. Laryngeal paralysis, we have seen there can be loss of voice, effective cough may be present. Limbs, most commonly involved parts are dorsiflexors in limb. So diagnosis of diphtheria, we will discuss the diagnosis and then prevention and control in next class. It is necessary for control and epidemiology purpose diagnosis. Based on the clinical feature, patient can be diagnosed. There can be laboratory diagnosis and diagnosis of the susceptibility. So clinical feature, you know that clinical diagnosis is based on clinical features, right? So fusial type of the diphtheria, thick yellowish membrane, black in the center, patient looks ill, right? So you already know the clinical feature. In case of the pharyngeal diphtheria, bull neck, lymph node is not palpable, right? So you know about the clinical features. Laryngeal, membrane is observed by laryngoscopy in laryngeal diphtheria. In laryngeal diphtheria, membrane is in larynx. So you cannot directly observe the larynx through examination of the mouth just with the help of the torch. You need to introduce laryngoscope. Dry copy cup may be present. Nasal diphtheria membrane is seen along the septum. If you have the examination of the nose through the speculum, nasal speculum, you can examine this nasal septum and turbinates. Diphtheric paralysis may be seen. No other clinical feature of the diphtheria paralysis are able to distinguish from the other paralytic disease. Laboratory diagnosis, here swabs are taken, like in case of the corona, swabs are taken, nasal swab and throat swab. Here also swab from throat, nose, larynx, skin, depending upon the lesion, where the lesion is. There may be tracheal exudate, it may be cultured, and culture medium is Loeffler serum slope. In doubtful cases, animal inoculation is done by subcutaneous route, but it is not practiced routinely. Usually, diphtheria can be diagnosed with the help of the clinical features. Right? And smear staining is by Albert stain. Serological tests are also done. So, in Albert stain, you can observe this Corynebacterium diphtheria, right? Thin, slender form. You can see in this slide also, dots are there at the end of the thick dots are there at the end of the this rod. Right? It is observed in club. Many of the diphtheria, this bacteria can be observed in V or Y form. Virulence test. There are two types of the virulence test: in vivo test and in vitro test. These tests are known as elect gel precipitation test and tissue culture test. If you have microbiology, gone through the microbiology, in this also separately short note on elect gel precipitation test is asked. So we are not going to discuss about this in detail. This is a part of microbiology as well as medicine. Just remember the diagnosis of susceptibility is by sick test. Remember the name of this test, sick test. We are not going to see about the reaction part. It is a part of microbiology and medicine. We are more interested in prevention and control, and this we will discuss in next class. Okay, so we have today discussed about agent, host, environmental factor. That is called epidemiology. Some brief problem statement about clinical feature, about complication of the diphtheria. Okay, write down your roll number in chat box and then leave the class. Roll number in chat box, write down your roll number and then end the class. Once you write down the roll number, you have to leave the class. I'm giving you just 1 minute. Within 1 minute, you have to write down and submit. Okay, fine. I have almost all of you have submitted the roll number.